The Lowcountry Lid Lift. It's our own unique approach to eyelid surgery. It's custom tailored to the individual patient's needs and desires, results in dramatic improvement, fast recovery, and it looks completely natural.
All right, we meet again, and today's YouTube video is about eyelid surgery. Not only is it the most common procedure, but it probably has one of the highest satisfaction rates compared to rhinoplasty, facelift, breast augmentation, and so forth. Eyelid surgery is relatively straightforward, simple, relatively quicker recovery, relatively less expensive compared to some of the other procedures. It just works well. There's different factors that make a set of eyelids look pretty and youthful versus aged. And you can break that down in the form of a matrix. And when you analyze it like this, you can see what are the issues and then what are the treatments. The number one contributor to aging eyelids is extra skin. And if you've got extra skin in the lower lids, extra skin in the upper lids, that requires surgery. And surgery takes care of about 90% of the extra skin. The second most common thing that causes aging of the eyelids is bulging orbital fat. There's sort of a tissue bra that lives in the upper and lower eyelids that holds orbital fat, that serves as a cushion around the eyeball, that holds that in a taut position. In a younger person, that bra is tight as a tick and there's no protrusion. As we age, what happens is the tissue bra loosens up and some of that orbital fat bulges out, and that takes surgery to take care of that. The other thing that happens simultaneously as that orbital fat bulges is the baby fat goes away. And so if you look at a young picture of Al Pacino, you'll see that his lower eyelid and cheek area was just smooth and convex like an apple. Whereas as one ages, what happens is the deep orbital fat bulges, the baby fat reabsorbs, and you get an accentuation of a bulge, and you get all these ripples that don't look youthful. Another thing that causes aging of the eyelids is wrinkles. A lot of people are prone to wrinkles around the eyelids before anywhere else. It's the thinnest skin on the body. It gets a lot of sun exposure. The other thing that can impact the amount of upper eyelid skin is brow position. If the brow remains elevated, there's relatively little upper eyelid skin redundancy. If the brow sags, then that can exacerbate that. And you have to factor not only brow position, brow sagging, but also brow asymmetry when you're tailoring the skin of the upper eyelid. Another thing which causes aging is crow's feet. A lot of people think that, or hope, that if you apply Botox to the outer crow's feet area to diminish the wrinkling with expression, that'll somehow magically make the rest of the eyelid work out. Botox works great for dynamic crow's feet that are not present at rest, but that are only present when you're smiling because it relaxes the muscle. And then the final thing that's commonly present in the aging eyelid is just some barnacles. And barnacles is just a term that I use to describe a variety of benign lesions such as skin tags, seborrheic keratosis, brown spots, melasma, and stuff like that. All of these issues can be addressed in the Lowcountry Lid Lift. Surgery takes care of the extra skin and the bulging orbital fat. Sculptra takes care of the fat loss. The wrinkles can be helped by surgery, but are helped most by a chemical peel, but can also be helped by Sculptra. If you restore the volume of the lower lid, you can expand that envelope and diminish the wrinkles. If you have a sagging brow, we can accommodate for that. It's very appropriate to trim a little bit of extra skin from the upper eyelids if brow sagging is a component. On the other hand, it's not appropriate to radically over-resect upper eyelid skin when the person really needs a brow lift. It's really not that common that you're forced to do a brow lift. Most people are content if you can alleviate a lot of the extra skin from the upper eyelids, and when they're awake and alert and in conversation, they have essentially no redundancy. But if the wedding photographer sneaks up on you at the wedding and you've had a couple glasses of wine, you're bored and your brow is real saggy, if you have a little bit of extra skin there like you did when you were 35, then that's not necessarily that big a deal, especially if you look really natural. There's plenty of examples in Hollywood of poorly performed eyelid surgery. What can go wrong with eyelid surgery is the most common thing is probably too much skin is resected, too much fat is resected, and that can create an unnatural appearance, a deep hollow, an eye, a lower eyelid that droops and exposes a little bit of the white part of the eye underneath the iris, the colored part of the eye. A lot of people ask about downtime. One of the reasons that eyelid surgery is one of the most common procedures that we do is because the downtime is relatively not only short but predictable. The most common pattern is we'll do the surgery on Friday, the stitches come out 5 days later, the following Wednesday or Thursday, and then you've got all weekend to play with makeup and cover up, and then most people are back at their 9-to-5 job the following week. 1 out of 10 is still going to have a little bit of a shiner that they'll have to cover with some makeup. Sculptra is a really powerful adjunct to eyelid rejuvenation. We talked in the Matrix about how surgery takes care of the deep orbital fat bulging, but it doesn't do anything to restore the baby fat that's lost. And for 10 years, first 10 years or so of my practice, I didn't have an adjunct that I could use to restore that baby fat. I did mess around with fat for a while, and while I got some good results, the results were unpredictable because fat grafting in the periorbital area, sometimes it works great, but sometimes you have significant reabsorption, sometimes you have insignificant reabsorption.
Here's a good example of a patient who benefited from Sculptra. You can see she's quite lean. And here we've delineated the valleys where we plan to place the Sculptra. And here she is without makeup, showing effacement of those valleys and just kind of a smoother, youthful skin appearance.
Incisions, there's 3 incisions in upper and lower eyelid surgery. The first incision is placed in the natural crease of the upper eyelid. In the lower eyelid, there's 2 incisions. One incision is hidden on the inside, and that's how you gain access to that soft tissue brow that causes the fat bulging. And then when you're done removing the fat from the lower lid, commonly there's a little bit of extra skin left over. And the only way to eliminate that extra skin is to make an incision in the lower lid. The key to having an undetectable scar there is to place that incision immediately at the lash line. And more than 90% of the time, that lower lid incision cannot be detected once it's healed. I'd like to show you now an excerpt from a couple of patients that had eyelid surgery here. There's some monologue of them discussing their experience. Some of the pictures are before their surgery, some are during the recovery, and then some are a few weeks after. They're all early results, so you still might notice a little bit of puffiness or a little bit of swelling, but I think if you compare their results to their preoperative status, they have a pretty nice result.
My eyes have been bothering me for a while. I've kind of watched my mom and dad over the years, and I know what's in store for me aesthetically, and this is as good as it's gonna get. So I figure, why wait? I'm 38 years old, and the hooding on my eyes, that's sort of why I'm here today. I've noticed since I was probably in college. Never really bothered me, but I've definitely noticed. And I've always had these what we call fat pads underneath my eyes, and I have allergies, which sort of exasperates the whole puffy eye look anyway. Again, really didn't bother me until probably a couple years ago, mid-30s. I'm starting to lose some volume in my face. And what I don't like when I look in the mirror is no matter how much sleep I get, I exercise, I eat well, I drink plenty of water, I always look tired. And so I'm here to get these fat pads to go bye-bye and some Sculptra put in here to hopefully give me a little more volume back and to get rid of the hooding around my eyes. I really want to match how I feel inside with how I look. And I feel good, I have plenty of energy, but I just constantly look tired and I want to feel refreshed. I'm here, it's day 5 from my surgery day, and I'm here today at Dr. Funcik's office to get my stitches out. I'm super excited to do that. I have to say that this has been an incredible experience. I would do it again, and I mean that in the sense that I really didn't have any expectations going into the surgery about what I was going to look like. or how it was going to feel, and I've had no pain. So I am really happy to share that with you. I think the hardest part for me was around day 3. My eyes itched, and that's probably because I have a little bit of the dry eye syndrome anyway. But other than that, it has been smooth sailing. The bruising that you see on my face, especially on my lower eyelids, is coming from the sculptor injection, not from the surgery. So as far as the swelling around my eyes go, I would say that's probably normal as far as what to expect for post-surgery upper and lower eyelids being 5 days out. I don't match how I feel inside. I actually feel great. I think that I look like a little bit like a train wreck, but I feel great. And I actually had to hold myself back from doing too much. Really tried to obey the rules of resting and drinking plenty of fluids and getting plenty of sleep and not eating too much salt to keep the swelling down. Today is 24 days post-surgery, and I am absolutely thrilled and believe that I made the right decision in doing my upper and lower lid surgery. I've been out a couple of times to separate events, and it has just been such a pleasure to actually be able to put makeup on and see my eyelids. I would do it again in a heartbeat. I would do it tomorrow if I had to, and I'm just so grateful for the results.
But I had my eyes done, and part of the reason I wanted to get that done, I could tell they were starting to look a little bit tired and wanted to look young, so I talked to a gentleman at the gym that's a doctor in the area, and he found out that Dr. Funcik was one of the best in the community. So I scheduled an appointment and met with him. He treated me comfortably, made me feel okay that I was a male looking into this, and then I decided to go ahead and take the risk and do it. We scheduled it on the Friday before Thanksgiving, so that way I could take the week off and it would be completely transparent. I went into the process and everybody made me feel very comfortable. I was very nervous and they understood that. And at the end of the day, I felt very good when it was complete. I followed the directions to the T. I felt elevated. I followed everything and the bruising was minimal. And on the 4th day, I could actually go out in public and people couldn't even actually tell that I'd had surgery.
Here's another patient that had eyelid surgery. She was just a couple weeks out, but she was so pumped about the result that I wanted to include her.
Yes, Dr. Funcik did eyelid surgery on me, upper and lower eyelids, 2 weeks ago this day. Downtime was minimal. I followed every instruction, that I was given, followed every step, of the procedure for recovery. And I would say probably within 4 days, I was feeling very normal. I wish I hadn't waited this long. I would absolutely do it again. Absolutely, yeah. And I would tell anyone, have no fear, have absolutely no fear. As long as you follow the instructions, and everyone here especially is so caring, and they were they followed up, they contacted me. I mean, you're not like another patient, you really are someone that they care for.
What's the recovery like from eyelid surgery? My most common scenario is the patient will do the surgery on a Friday and take the next week off. The day of surgery, the next day, they rest. They sleep in a recliner with their surgical site above their heart. They use non-prescription eye lubricant drops. And if you're in a hurry to get better as soon as possible, which who isn't, then what we do is the day of surgery and the next day, you spend about half the time with cool compresses. We take a piece of sterile gauze, dip it in some ice water, and rest it on the eyes. It's usually soothing. And then you take a baggie of ice chips or frozen peas, you rest it on there, and then we provide this ACE wrap affair, what's not meant to be compressive like an ankle wrap, but it just holds it on there. And what is the Lowcountry Lid Lift? The reason I came up with it is because I was raised to do eyelid surgery, and I did a lot of it, and I had a lot of happy patients. But and if it's performed skillfully, it's always a lot of progress in the right direction. But I had a handful of patients where their wrinkles weren't as corrected as they wanted, or they still had some irregularity and they didn't have smoothness in the lower lids. And now that I have Sculptra, I can restore that volume. And when you place Sculptra in the lower lids, not only can you smooth out the volume by and replace some of the fat that's lost naturally with aging, but if you expand that volume, then wrinkles get a little bit better.